Good evening, everybody. My name is Dr. Chris Bird. I'm here to deliver this week's COVID-19 pandemic report on behalf of the COVID-19 Task Force for the Coastal Bend. We had a few technical difficulties getting the stream going today, but I think we're up and running and we're going to move forward. Maybe we're going to move forward. There we go. Okay, so the task force has two objectives. The first is to address public concerns and questions about COVID-19, as well as to enable evidence-based decision-making on behalf of our local leaders. Presently, according to nueces.com, the risk dashboard says that we're at high risk for COVID transmission in the community. To help combat this risk, everybody's encouraged to get vaccinated. And I've been informed by the public health director that everybody above the age of 18 is eligible to get vaccinated starting Monday, and you are eligible to register right now. And I know that there are slots open for next week. So if you're interested in getting vaccinated next week and you're 18 years or older, then you should go to cctexas.com and fill out the registration form. Let's see, there's also a phone number that you can call just in case you're not on the internet, and that is 361-561-1101. You can call that number. It's to the Public Health Department, and you can register to get vaccinated that way. Once again, that number, 361-561-1101. Okay, in addition, you're encouraged to avoid crowds. You're encouraged to wear face coverings while out in public and social distance, and isolate when exposed to COVID-19 or symptomatic. There's partial to all remote schooling occurring within the Coastal Bend area and across the United States presently, and all these things are being done to try to control the spread of COVID-19. Okay, to our overall totals. Presently, there are 41,758 total confirmed cases in the Coastal Bend since the start of the pandemic in March of 2020. A confirmed case is a case that has been identified by the gold standard PCR test, or a case that's been identified by one of the other tests combined with a physician's diagnosis. Of those total cases, there are 39,867 recoveries, and we're presently at 680 active cases, which is down only 1% from last week. So the number of active cases is really leveling off, and we're getting a balance now between new cases and recoveries that are occurring. So the scenario that I think we all want to know the answer to is, what would happen if we just all unmasked and tried to go back to normal right now and let vaccines take care of the transmission rate? What would happen versus if we stayed the course and continued to implement all of these interventions to control transmission? We have the same primary assumptions of the model this week as last week. So we're going to call this the unmasked model. It's overly optimistic. We assume that the recovered are immune. So if you had COVID-19 and you recovered, we're assuming that you're immune in this scenario. We assume that the vaccinated are immune. We know that at least a small percentage of people can get COVID-19 after being vaccinated, or can get COVID-19 after having recovered. The transmission rate, we're assuming that the transmission rate will not be affected by new variants. We know that the transmission rate can increase by over 50% with some of the new variants. So this is an overly optimistic assumption. And we're going to assume that there are 30,000 new vaccinations per week in the Coastal Bend. And as far as I know, we haven't achieved that yet. But we're going to assume that starting next week, we are going to achieve it. So those are the major assumptions of the model that are overly optimistic. The other assumptions of the model that make it the go back to normal or unmasking model, there's a little typo there, is that we are assuming no other mitigations, no masks, no social distancing, no remote work or school, everything in person, and everybody goes back to normal. So in orange, we have that try to go back to normal and unmask scenario. And in blue, we have the stay the course projection. And so what we project would happen is there would be a rapid rise in transmission rate if we all went back to normal right now, and it could get up to above 2. And what that means would be that for every person that contracted COVID, they would pass it on to 2 additional people. This would result in a rapid spread of COVID in the community versus what's projected right now, which would be in 100 people, an additional 91 people would get infected from 100 people contracting COVID in the first place. So that's a decrease from 191, and that would be a decline like you see here. So that's why this number 1 is that transition between increasing and decreasing. So what would this look like in terms of numbers of new cases? Well, in terms of numbers of new cases, if we all try to go back to normal right now, given the model, it would look like a peak that's actually quite a bit higher than we had in the summer of 2020 here in the Coastal Bend. And if you're tracking this from week to week, you might say, well, this peak's a little bit higher than it was last week. Why? Well, the reason why is because I have to enter a lot of interventions for each week's vaccinations, and there was one extra one in there that went over the whole period of time last week that made it a little bit more optimistic than it should have been. So I fixed the model. This is a more correct representation of that unmasked model versus our projection moving forward, which is if things continue the way they have over about the past month, then we would expect a continued decline in the number of new cases per day. I'll remind you that the black dots are the actual number of new cases per day, and you can see we have a pretty good fit of the model to the data up through the present. So if we look at the actual number of new cases per day in Nueces and in the other Coastal Bend counties, we can see that it's been approximately level, possibly increasing slightly over the past week. But these changes that we're seeing here didn't seem to be enough to change the calibration of the model. Also, not all the counties in the Coastal Bend are increasing, but the ones that you see here at least have an appreciable level of new cases per day, with Clayburgh, San Patricio, Bede, Jim Wells, and Aransas counties also having more than 0 new cases per day on average. Looking at the whole state of Texas, these are the public health regions. We are here in South Texas. And if you look, you can see that since the end of the mask order, there's been a little bit of an uptick or a leveling off of the number of new cases per day per 100,000 people in these regions. We normalize by cases per 100,000 people to have a level playing field with which to judge the relative amount of COVID that's in these different parts of the state. So these could remain low, or this trend could start to continue upwards. And with our model, we're remaining optimistic, and we're hoping that this is just a blip on the radar that will go down again. But really, we'll need to see the next few days. If before next Friday we change our minds and we decide, no, it's really, this is more than a blip on the radar, we'll update the projections on social media. When we look at the number of inpatients with COVID in the Coastal Bend right now, those are here in the black dots. So each black point represents the number of COVID positive patients in the hospital per day. If a patient is in the hospital across multiple days, they'd be counted on each of those days in each of these dots. So it's not the number of new people going to the hospital, it's the number of people that are in the hospital now. And overall, there's still a downwards trend. There's been a little bit of variation in the past few days, but if you look across the whole pandemic, at least since the end of May in 2020, you can see that there's been different points in time when we've had some fluctuations like this, and they didn't mean very much. So we're right now projecting a continued decline. The one thing that is starting to be quite noticeable here is that the model matches the data fairly well back here in December and January, but as we're moving into 2021, there seems to be more inpatients per COVID case than in the past. And this could be because the hospitals might have a lightened load and they're accepting more COVID patients. It could also be because of the new variants that we know are showing up in the Texas community. It's probably a combination of those things, as well as it could be driven by data lags in the number of new cases. So we're looking at this. It's different than something that we've seen before, and we're going to leave the projection the way it is for now, but we might need to adjust the hospitalization rate upwards. But we're still waiting a little bit longer to determine if we should do that or not. Okay, going on to ICU patients. Right now, there's been an approximate leveling of the number of COVID-positive ICU patients in the Coastal Bend over the past week. Between yesterday and today, or between actually yesterday and the day before yesterday, there was a slight uptick. But if you look across, all these time points, it's basically a level trend. There's 154 non-COVID patients in the ICU right now, and I'll direct your attention over here to before we had that major summer 2020 spike, where approximately 148 non-COVID patients were in the ICU on any one day. So what this means overall is that we're about able to handle the capacity or the number of non-COVID patients needing ICU care now as needed them before the pandemic really got going. So that's at least a good sign that we have the staffing at the hospitals. That being said, I have it on good authority directly from people working in healthcare and at the hospitals that they're really tired, and they've been overworked for well over a year now with COVID, and they're really reaching out to the community and asking for a break. So if you're looking for motivation to wear that mask, think about our healthcare workers that would really like to take a little bit of a COVID break. Okay, looking at that same graph, but across the whole state of Texas. So this is the last graph we were looking at. So we have similar graphs like that for the whole state. You can see that there's generally a downwards trend or a leveling off trend in all the different trauma service areas in Texas. And if we look at just the last day, March 25th, what we see here is the blue represents non-COVID patients and the red represents COVID patients. And the more blue you see, the less pressure there is on the ICU from COVID. So we've remained here in the Coastal Bend fairly low throughout the winter spike in terms of the amount of pressure on the ICU, and the rest of Texas is catching up with us now, and they're seeing a little bit bluer skies also. So moving on to fatalities, there's been a decline in fatalities. We expect that decline to continue for the foreseeable future. I'd like to point out here that I'm not showing the what if we take off our masks projection because somebody very astutely pointed out last week that, what about all the people getting vaccinated that are over 65, or the people getting vaccinated that are at higher risk for complications of COVID-19? And I thought that was a valid point. And until we're able to pin down vaccinations to age brackets, then we'll just project the number of new cases, and we'll refrain from projecting a what-if scenario on fatalities. Now, that being said, realize that with the new variants, there's data that's coming out that's indicating that not only can they lead to higher hospitalization rates, but also to maybe higher fatality rates also. So there is some sort of balance there between people getting vaccinated and new variants coming out. So that being said, we're expecting a continued decline in the number of fatalities in the Coastal Bend, and we'll update this if the cases really do start rising substantially. Then we will expect that there could be a rise in fatalities. Okay, so far across the Coastal Bend, there's been 1,211 people that have died from COVID-19. I want to remind everybody that this tally is done by the state, and they have a team that inspects death certificates one by one, and if the primary cause of death is COVID-19, then they end up in this count. Right now, we're at 744 fatalities for the county of Nueces. So you can subtract 744 from 1,211, and you can get the number of fatalities occurring in the rest of the coastal bend that are not part of Nueces County. Again, these death certificates are still being counted, but there is a decline in the number of new fatalities, and so this leveling off is it's a product of those two processes. One, counting the death certificates, but two, there's also fewer fatalities. All right, moving on to more positive notes, which is on vaccinations. And the more that people are vaccinated, these are like direct discounts off of the transmission rate of COVID-19. So in Nueces County, right now, we're at about 14% of the people have been fully vaccinated. That means that for whatever the transmission rate would have been without the vaccinations, it's 14% less. And so for that reason, what we want to do is get as many people vaccinated as possible so that we can, get higher and higher discounts off the transmission rate until we won't go through another spike or another surge in COVID-19. And at that point, hopefully the pandemic will effectively be over. Okay, if we look at the whole state and see where we're at, and if you've been following this, the coastal bend started off middle of the pack in terms of the percentage of the population that's fully vaccinated, but it's slowly been rising. And at this point, it's nearly at the top, maybe tied with Trauma Service Area I in the border area. I believe that's El Paso. And so between those two trauma service areas, that has the highest rate of fully vaccinated people in the state. And so that's good. And everybody in the coastal bend that's gotten vaccinated should be congratulated. And I want to remind everybody that there are open slots to get vaccinated next week, and everybody above 18 will be eligible. So what we're hoping is those slots fill up and that we're able to keep rolling out these vaccines and increasing the proportion of people in the coastal bend that are getting vaccinated. Okay, lastly, and we use these cell phone metrics to look towards the future. We know there's a lag between when somebody contracts COVID and when they become symptomatic. There's another lag between that and when they get tested. Then another lag for some people if they end up in the hospital, so on and so forth. So what these cell phone metrics can give us a window on is what's happening right now, or at least as close to right now as possible. And right now we're in this spring break period where we're seeing an increase in non-essential visits above normal. This line here represents the level of non-essential visits, distance traveled, and encounters that were occurring in January and February of 2020 before the pandemic had started. And so right now we're above 100% on that reference point, and so we're above normal for before the pandemic started. In terms of encounters, we're still below 50% of normal, but steadily increasing. I think the important thing to note here is that we're steadily increasing in both of these metrics, and if all else is equal, meaning that we continue to wear our masks, we continue to do the same basic things that we were doing to prevent the spread of COVID, except we have more encounters, we have more distance traveled, we have more non-essential visits, that's going to lead to a little bit higher transmission rate. And so as these values increase, if we don't increase our vigilance, then transmission will also increase. Now, what's happening is as these metrics increase, at the same time, more and more people are becoming vaccinated. So right now, it looks like it's kind of a wash, and that's why we keep getting the same estimated transmission rates each week. Okay, so in summary, the new cases are level to slightly increasing. It depends on where you look in the coastal bend and in the state. Right now, we're projecting that the transmission rate is below 1 and that the cases would be level to slightly decreasing. So we're in quite an uncertain time right now. In terms of hospitalizations and fatalities, they're declining, but the ICU stayed level for the past week, so that's something to note. And the cell phone metrics are most certainly rising, and that's something that we can be certain about. And the results of the model indicate that if we only rely on vaccinations to slow down COVID transmission, there's probably going to be another major outbreak, and it could be bigger than the one that we saw in the summer of 2020. And so what that means is that there's still quite a large proportion of the coastal bend that hasn't been exposed to COVID-19 or vaccinated, and thus they could fuel another outbreak. So everybody's recommended to stay vigilant. We've come this far. It's not that much farther. Let's just stay the course here. Get vaccinated if you can. Wear your face coverings. Those KN95 masks fit really well. They stop my glasses from fogging up. I recommend it if you can find one. Otherwise, double up. The better seal you can make between the mask and your face, the better protection you have against COVID-19. And this combination of a cotton mask with a surgical mask has been shown to be up to 92% effective on that KN95 or N95 scale. So it's not too bad. If you combine that with social distancing, you're really decreasing your chances of contracting COVID. And try to avoid multi-household celebrations. I do want to point out that the CDC has recommended that it's okay for people who are vaccinated to visit with other family members in single household sort of scenarios. Like, you're not recommended if you're vaccinated to have a huge party with your extended family, but you can go and see your grandchildren and things like that without without much worry. And so hopefully as we move forward here and move closer to herd immunity and have more and more people getting vaccinated, the CDC will make even more recommendations on how we can roll back the things we're doing to try to prevent the spread of COVID-19. So that's it for the report for this week. I want to remind you that we accept comments and feedback on social media. Our handle is @CBCOVID, and they do have an effect. We altered our projections this week, and we wanted to be a little bit more conservative than we had been in the past based upon some user feedback. So please keep that feedback coming. Facebook, Twitter, Instagram, we're on YouTube, and let us know how we're doing. We have a question and answer period on Fridays at noon, where myself, the public health director, and two members of the task force, Tiffany Anderson and Jason Lewis, help to answer your questions directly live. If you have questions that you want to ask live, you can tune in for that, and we're happy to answer all questions. So I hope everybody has a safe and good weekend, and we'll see you next week.